A frequent question that I get is one of, at what age do I need to consider a facelift? Well, I really wouldn't say it was age specific. And the reason I say that, there are different varieties, if you will, of skin tightening procedures or facelifts. One is what I call a cheek, a mini, or a temporal facelift. So it's an incision there that goes under the sideburn, down in front of the ear in that groove, and stops at the earlobe. And I can pick up this portion of the cheek and pull it back up. So it's good for a younger patient, maybe as early as her late 30s, certainly in her 40s, and even in their early 50s. Those patients may have a little bit of jowling, they've got a deepened nasolabial fold, they may have a hint of a puppet or a marionette line. Their neck's in good shape. They still have a nice, crisp cervical mental angle, meaning that the chin goes back and then down. It's an acute angle as opposed to an obtuse angle where the chin kind of bleeds into the neck. The next level up would be what they call a full facelift. And so a full facelift, same similar incision here in the front, and then goes up behind the ear, across the occiput or that bare area behind the ear, and then down in there. That allows me to pick up the cheeks here and to pull back on the neck at the same time. So platysmal bands, or those prominent bands in the central neck region, fat in the central neck region, or lax skin in the central neck region, is addressed as part of a facelift. So, there are some patients who I do a neck lift alone, but by and large, most of those are going to be a candidate for a facelift, which includes the neck. And ideally, in my mind's eye, should be called a face/neck lift. In men, sometimes we're able to come in and do a zigzag or a lightning bolt type excision of this redundant skin in the central neck region. I don't like doing it on women, and the reason I say that is men have bearded skin, and as a consequence, I think the scar hides better. Then two, if they didn't like the scar, of course they could grow a beard to camouflage it or cover it. Another thing that's important in patients who are considering facial rejuvenation surgery is do they have adequate chin projection? My generation, and certainly generations after mine, most of the kids wear braces now as teenagers or adolescents. And so a lot of times that can correct an orthodontia issue, but if you have a weak chin projection or retrognathia where the mandible or jaw as it formed didn't rotate and if you will come forward enough, those people will have a lot of fullness here in the central neck region. So sometimes in a facelift patient, you need to add a chin implant to get that angle to be exactly where you want it to be. A lot of times too, it's easier to do a minor or a smaller lift and then follow up 10, 15, 20 years later with a more formal facelift. Everyone's always concerned about the potential to look like Kenny Rogers or Dolly Parton or to look overdone. Those are people who have disappearance of the sideburn area because all the incisions have been done up into the temporal forehead, and that's kind of an odd look. And then two, at some point, the prudent plastic surgeon has to say no. You're not a candidate for additional tightening. But secondary, and even in some scenarios where people have real light skin, a tertiary facelift is a good option for them. But again, to me, the objective is to have a natural look, something that says, hey, I'm refreshed. Maybe I'm not as old as I am based on the clock or the calendar, but at the same time, not to appear bizarre or odd.